Guys, a very good evening to all. I hope I am clearly audible and visible to all. Very good evening to all. Vanakkam, Shashrekal, Assalamu alaikum, Game greetings to all. So this is a short and sweet session for your rapid revision for upcoming exams of FMGs to be held in December month. So we'll be discussing lots of questions. So I'll be quick, and I'm taking into consideration that you have read the subject at least once. Okay? And this session will help you all to revise important key areas. So before starting the session, you all should give this Unacademy Combat, which is going to be held on October 16th at about 12 o'clock in the afternoon. 50 questions in 60 minutes based on the year in which you are in the MBBS, and what will be the achievement based on your rank. You will get an All India live rank, and based on your ranks, you will be getting these gift vouchers. Okay? So rewards should not be missed, isn't it? And give it to assess yourself. Very good evening to all. And the prices for your plus subscription have been decreased, and the batch courses for NEET PG, upcoming NEET PG has been launched, and question bank 2.0 is now available. And now we are good to go to move ahead with the session. Clearly audible and visible. Shuru kare. Let us begin with first question. A 25-year-old lady died due to some unnatural cause within 7 years of marriage. The inquest usually should be done under. Answer. The inquest should be done under. Answer quickly. The correct answer goes with yes, always option B. Why option B will be your correct answer? Because of the simple fact that the question is about inquest. What is inquest? It is a procedure. The crime has already occurred. The death of the female has already occurred. So yes, the investigation will be done under criminal procedural code sections, and yes, it becomes a sort of magisterial inquest. Why? Because the death has occurred within 7 years of marriage, and to be exact, suppose this is a unnatural cause and it was discovered during investigation that yes, it is a case of dowry death. What is dowry death? Death of a married female within 7 years of marriage. And if it is proved that just before death there was demand for dowry either by husband or by any relative of the husband, the case becomes a case of dowry death under 304B IPC, where the minimum punishment is 7 years and maximum is life imprisonment. And when the matter is brought into consideration of the police officials, yes, they will inform a magistrate that such a case has occurred, and yes, it will be investigated under the supervision of a magistrate. So it is magisterial inquest. Now, if the lines of the question are twisted like this, I say that the case will be lodged under. This case will be lodged under which of the following sections? Now we know that a case is lodged under IPC sections by the policeman in the FIR. FIR is first information report. So the case will be registered if it is dowry death on preliminary investigation. Yes, the initial FIR, the section will be 304B IPC. Life imprisonment normally means remainder of whole natural life, but based on Supreme Court judgments, our Honorable Supreme Court judgments, after a time span of 14 years in the prison, the accused person can appeal based on good conduct in the prison. The matter can be appealed that he can be brought into mainstream society. So this is what happens in it. So it is based on the judgment of that appeal that whether he will be freed from his charges or whether this life imprisonment will continue beyond 14 years. I hope it is clear, Kapil. What is 304A IPC here? Death due to negligent act. that negligent act can be by doctors or by hospital authorities. So yes, death due to negligence. Any type of negligence, like all road traffic accidents are a sort of negligent act of the driver. So road traffic accidents, if leads to death of the victim, the initial section in the FIR will be 304A IPC. Death due to negligent act comes under 304A. And 174 CRPC, we all know, yes, it is police inquest in India. In India, we have police inquest and magisterial inquest. Correct? So, let us move on. Identify the fingerprint pattern shown in the image. Loop, whorl, planar, tented arc. What do you think? Identify the fingerprint pattern. क्या लग रहा है? What do you think? The correct answer goes with planar. Correct? Because the ridges are coming and moving away, coming and moving away. They are not converging on itself, and nowhere in the fingerprint we are seeing convergence of ridges from three sides. So yes, this is arches, and to be exact, planar. Tented arc will be like this. You will see a tent house. You will see that the ridges are moving at an acute angle, and at the base of the ridges you can see a sort of delta. A delta might be seen in the tented arches. When do you say a pattern to be loop pattern? When you see one core and one delta. In whorls, what is present? A central whorl pattern with two deltas. And what is composite pattern? Not following this rule. All this rule makes your print as composite. Correct? Overall, which is the best method of identification? Fingerprinting. What are the synonyms of fingerprinting? Try to recall in your mind. What are the synonyms? It is also called dactylography, dermatoglyphics, or Galton system of identification. When does fingerprinting start to develop? What is fingerprint? Impressions of epidermal ridges. So these ridges development start in intrauterine life itself. So their development start. See the word start at about 6, sorry, not 6. It is completed at 6 months. So it should be 4 months. Correct now? So it starts at 4th month intrauterine life, and the development is complete by 6th month intrauterine life. This was asked na, in June month. So fingerprinting to be revised before your actual exams. Okay. How the question was asked? Fingerprints develops by. Now this is English language again. Develops by means the complete development occurs by. So answer will be 6th month, corresponding to 6th month. 6th month means how many weeks? 6 into 4 is 24. Yes, it will be 24 weeks. Or I say 6 months. Answer this one. Which of the following IPC section is related to medical negligence? Which IPC section is related to medical negligence? ये तो सबको पता है. Everyone knows. Very good. This was dowry death. What is 300? This defines murder, and 302 defines punishment for murder. Punishment for murder. 304 is death due to medical negligence, means negligence of either doctor or the hospital. And revise this topic. In last June month, you got one question from negligence topic na, regarding contributory negligence. So revise that topic as covered in classes nicely. Fingerprinting and medical negligence topic. Then answer this one. Under what circumstances dying declaration given by a person of sound mind becomes inadmissible in courts? Let me see who answers it fastest finger. Yes, Rahman. Very good, Rahman. So correct answer goes with option A. If the victim survives after recording dying declaration, what will the judge tell the lawyer? That please call your client. This victim has made a complaint to the police, so the matter has gone to court. So this victim will now come to court to record their oral evidence. Because dying declaration is which type of evidence? Document has been prepared by someone. It is documentary evidence. And which one will have a higher weightage? Always oral evidence. Why? Because cross-examination of the witness can be done. Then courtroom procedures and all should be revised before actual exams. Okay? So oral evidence will have a higher weightage. Yes, now the victim will be called to court to record his or her oral evidence. When the dying declaration is half recorded, yes, it is admissible. If it is not signed, yes, it is admissible. If it is recorded by doctor, yes, it can be recorded best if recorded by a magistrate. Not available, the person is dying in hospital, doctor can record. The person is dying in village, any person can record. Any person can record the statement of a dying person. That is what is called dying declaration. And it is a documentary evidence presented in the courts. If the patient dies, if the patient is surviving, yes, he will be called to record the oral evidence. What do you call this? Sexual gratification through obscene telephone calls. Through obscene telephone calls. क्या बोलते हैं? Obscene means dirty. The person has a unique way of getting gratified or getting that pleasure. Sexual pleasure through obscene telephone calls is called scatologica. What is scopophilia, scoptophilia, voyeurism? They are synonyms. And it is also sometimes called as peeping Tom, and it is a punishable offense in India. Under 354 T IPC. Correct? No? What is voyeurism? Act of voyeurism simply means whoever is watching or capturing private moments of a female secretly. Males don't have private moments, legally speaking. So this section in particular is going to give justice to females. So if someone is watching or capturing private moments of a female secretly, it is an offense called voyeurism in India. What is this? Medical etiquette is related to. Medical etiquette kya hoga? These are simple questions, but they are very pinching questions. Chances of silly mistake is there. Etiquette means moral science. Moral science means courtesy, not moral principles. Etiquette is courtesy. What do you call this? Option here the correct answer is option C. What is moral principles followed by doctors among themselves, or the moral principle is followed by the doctor with the patient, or the moral principles are being followed between doctor and state relationship? This is what is called ethics. Courtesy is etiquette. This is a dictionary word, while ethical word is given to us by our National Medical Commission. National Medical Commission. So these key definitions which we cover in the initial part of our classes now, so they are very important. Definition of medical ethics, etiquettes, then Consumer Protection Act, all these are important areas. Now what is pugilistic attitude? This is seen in pugilistic attitude is seen in. Go on solving the questions, all of you, those who are joining the sessions in between, go on solving the questions. The previous ones you can watch. These sessions will be available on YouTube for lifelong. Not to worry. Pugilistic attitude is seen in, yes, they can be seen in burn injuries. They can be seen in burn injuries. Which burn injuries? Burns which are of very high temperature burns, like more than 65 degrees centigrade. The person's body muscles were exposed to such high temperature. So such high temperature will lead to coagulation of muscle proteins. What will happen is coagulation of muscles of that person, and yes, it will give rise to an attitude of flexion, also called as pugilistic attitude, also called as boxer's attitude, also called as fencing attitude. These are the synonyms. Is it antemortem, postmortem, or both antemortem and postmortem? That is unethical act. Dr. GSN, that is unethical act. Pharma companies, you are receiving gift from pharma companies, that is unethical. Unethical. Unethical acts by a doctor is also called as infamous conduct by a doctor or professional misconduct by a doctor. This is what you are asking, I think. So pugilistic attitude is, coming back to the previous question, it is both ante-mortem and post-mortem phenomenon. It can be seen in a living person due to extensive burns. It can be seen when the dead bodies are cremated. Dying declaration comes under which of the following sections? Dying declaration comes under, declaration is a evidence. It is a sort of documentary evidence. So yes, it will come under Indian Evidence Act sections, to be exact, 32 section of Indian Evidence Act. What is another name for this fracture? With this, we will revise the key points regarding fractures. They are very fond of asking questions from this area, skull fracture types, in FMG exams in particular. Fracture a la signature is another name for depressed fracture. Out of these options or overall, which is the most common type of skull fractures? Most common type of skull fractures overall is this one, linear fissured fracture. Gutter fracture was asked in recent FMG exam itself. No? Gutter fracture is due to tangential gunshots. It is due to tangential gunshots. And what is the question about fracture a la signature? Is depressed fracture and it is produced due to impact by weapon like this. A weapon like a hammer. So hammer is a heavy weapon with a small surface area of impact. So when it makes an impact, the fracture will be of the size of the impacting surface of the hammer, and the fractured margins of the skull bone will be depressing. They will be depressing inside the cranial cavity. What is ring fracture? Fracture around foramen magnum. Fracture around foramen magnum at the base of the skull. Then what is Pond's fracture? Pond's fracture is also called as ping pong fracture, also sometimes called as indented fracture. Also called as indented fracture. These mainly occur in infant age group due to soft pliable skull bones. Mainly in infant, when the fontanelles are open, na, like if this is your skull bone, we know na, that these are my sutures, coronal, in midline sagittal, posteriorly lambdoid. So anteriorly we have anterior fontanelle. What is the age of closure for anterior fontanelle? Age of closure of anterior fontanelle is 1.5 to 2 years. Posteriorly we have a posterior fontanelle, and the age of closure of this fontanelle is 0 to 6 years. Sorry, 0 to 6 months. 0 to 6 months. So yes, in this age group, when the fontanelles are open, indentations can occur, which is also called as Pond's fracture. Foramen magnum fracture will be like this. Like suppose I draw your skull base over here. Suppose this is your skull base. If you see the anatomical image of the skull base, you will see bony projections of a sphenoid bone. In the center will be your foramen magnum. So any fracture along foramen magnum is referred to as ring fracture because it is in the shape of a ring or circle. This fracture is also called ring fracture. Mainly associated with, this is mainly associated with fall from height cases. This one should be preferred as an answer over road traffic accident. In fall from height, what happens? If someone falls from a greater height, what happens is, suppose this is the fellow who has fallen from a great height, and the first part which made an impact with the ground was the foot area. So there will be fracture of foot bones. This pressure was so large that it transmitted upwards along vertebral column, and it can cause fracture of thoracolumbar vertebra. The pressure was so large that it traveled upwards along base of the skull and can lead to this ring fracture. Clear? So these are some named fractures. What is another name for sutural fracture? Fracture is present along coronal suture of the skull vault. What is another name for sutural fracture? Anyone? Quickly. Another name for sutural fracture of the skull? Another name for sutural fracture. Diastatic. Very good, Abhi. Fastest answer. Others also must be known. So diastatic fracture is sutural fracture. These are all the named fractures. Then at the base of the skull, we have hinge fractures. Na? Most common type of hinge fracture is type 2 hinge fracture, which is also called motorcyclist. So if in this base of the skull image, I have to draw the hinge fractures, I can say that yes, if the skull base is divided equally into two halves, anterior half and posterior half, this one is type 2 hinge fracture, also called as motorcyclist fracture. If the fracture line is dividing my skull base obliquely like this, so this one is type oblique fracture line is उल्टा बोल रहा हूँ चलो I was waiting someone to correct me. किसी ने correct नहीं किया. चलो अब पढ़ते हैं. So, if the fracture line can be like this, let us assume, then the fracture line can be like this. This is oblique orientation. This is equal division of the skull base. And third way, the fracture line can be like this, unequal division. This equal division is one line. So this is type 1 hinge fracture. This is the trick to remember. Oblique fracture is type 2. Unequal division is type 3 hinge fracture. Easy to remember na? Kabhi galat nahi ho. You will not make a mistake ever. Type 1 is equal division, and it is this type 1 which is called motorcyclist fracture. Motorcyclist fracture. This is the most common type of hinge fracture seen at the base of the skull. Okay, type 1 equal division, anterior half, posterior half. Unequal is type 3. Type 2 is oblique division. Answer this one. Lucid interval is mostly associated with. Answer. Lucid interval is mostly associated with EDH, preferred as an answer over SDH. SDH can be seen in which cases? Most commonly, acute boxing injuries. Acute boxing injuries. SDH can be seen in battered baby syndrome as the most common cause of death. What is battered baby syndrome? Also called as Caffey syndrome or shaken baby syndrome, where a child will present in the casualty with multiple injuries of different age. Lucid interval simply means the phase of consciousness between two unconscious phases. The person was initially unconscious. He regained his consciousness after 10 hours or 12 hours. He again becomes unconscious. Yes, the person is showing you lucid interval phase. Most common etiology in relation to intracranial hemorrhages, EDH, can be seen in SDH. And this is the term also in relation with insanity, where what is lucid interval? The person was initially insane, means mentally ill. With treatment, he became a person of sound mind, and thereafter few days he again becomes mentally insane. So here lucid interval is this period of sanity or sound mindedness between two insanity phases. Correct? So these hemorrhages are also very important. Images of all these hemorrhages we have seen in our classes now multiple times. Answer this one. A person after being hit by lathis is admitted in a hospital for 20 days. Which of the following indicates grievous hurt? Last session you got one question na, from this same thing. So this is another way of asking the same question. Answer. A person क्या होगा? A, B, C, D. According to which clause of 320 IPC? Number भी बता दो. Tell me that number 2. According to clause 8. So clause 8 of 320 IPC says that any hurt endangering the life of the person or which causes either of the two things for a period of 20 days. Which two things? If the person is in severe bodily pain, or the person is unable to follow his ordinary pursuits or daily routine activities. 8 clauses पूरे याद रखने हैं. एक बार quick recap कर लें. Let us do a quick recap of all the 8 clauses in the same sequence. Clause 1 is emasculation. Clause 2 is related to permanent privation of loss of vision of either of the eyes. Clause 3 is ears. Permanent privation of hearing of either of the ear. What is clause 4? Permanent privation of any member or joint. Member is any body part having its own function and which cannot regenerate if it is detached from the body. Clause 5 mein, what you have to do in clause 5? Reduce the power of any member or joint due to any injury. Clause 6 is disfiguration of head or face. Permanent disfiguration of head and face. Clause 7 is fracture or dislocation of any bone or tooth. And clause 8 we just revised. Fracture wala yaad hai? Fracture symbol has number 7 hidden in it. So fracture or dislocation of any bone or tooth will be clause 7. 6 is related to facial value. Permanent disfiguration of head and face. Now answer this one. Voluntarily causing hurt by dangerous weapon or means is punished under which IPC? Voluntarily. Yes, all the section, all the clauses to be remembered in the same sequence is very important for any exam. Last in June month, you got one question from 8th clause. You never know, no? They can give you a match the following clauses with their respective statements. This is a VIP topic, not to be left. Voluntarily causing hurt by dangerous weapon or means is punished. So the hurt has been caused by dangerous weapon. So this is punishable under? Answer goes with 324. 324. एक बार quickly revise करते हैं all these sections. 319 defines hurt. 320 defines grievous hurt. 321 and 22 define the word voluntarily. 321 and 22 define this word. Intentionally causing hurt and grievous hurt. Intentionally causing hurt in 321 and grievous hurt in 322. All these are definition sections in relation to injuries. Punishment sections are 323, 324, 324, 325 and 326. 323 says, I will define the punishment for causing hurt. 25 says, I will define the punishment for causing grievous hurt. In between lies two sections. So this 324 says, I will define punishment for causing hurt by dangerous weapon or dangerous means. And 26 defines punishment for grievous hurt by dangerous weapon. Okay, revise. So 319 to 326, these IPC sections deal with medical legal aspects of injuries, are important topic. Here the answer goes with 320. Answer this one. In which type of hanging constricting force over neck is weight of the whole body? The scenario is that this person has done the act of hanging. This was the ground. And he has done the act of hanging by putting something which can be used as a ligature, which ideally we should not do. We have been given a beautiful life and we should cherish our life, whatever may be the scenario. But this person was unaware of the beautifulness of life. So he did this. What will be the answer to this question? Weight of whole body will be acting in complete hanging. What is incomplete hanging? Suppose now I say that this fellow was sitting on a chair. Suppose this is the chair. And he committed the act of hanging by putting a ligature around his neck. Yes, some part of the body is touching the ground. And for us, this becomes a case of partial hanging. And partial hanging, what is the force which is constricting the neck? major role is now played by weight of head of the person, because the body weight will be distributed over those areas where it is in contact with the surface. They will play a role, weight of the body will play a role, but a insignificant role. So that is what is incomplete or partial hanging. What is typical hanging? Typical hanging simply means, typical hanging means when the knot of the ligature material is at mid-occipital region, not anywhere else, the hanging becomes atypical. Okay. Answer this one. Constricting force required for obliterating carotids in hanging is how much? To compress carotids, how much force is needed? 4 to 5 kg. Correct answer goes with option B. To compress IJV, pressure needed is internal jugular vein. Pressure needed is 2 kgs. To compress internal carotid arteries, about 4 kg, and about 15 to 20 kg pressure is needed to compress larynx and trachea. So which is the neck structure which will be most commonly damaged in cases of hanging? Internal jugular vein. Least amount of pressure is needed. All are different types of strangulations, except all are different types of strangulations. Which one is not a? This appears to be a simple question, but if you are in a hurry, you will mark it wrong. So never be in a hurry in the exam. Always maintain your patience. Have lots of patience, and that patience comes with your confidence. Correct answer to this one goes with Buns dola is strangulation by bamboo sticks. If you are in a fix now, so try to recall what is Buns dola. Yes, it is strangulation by bamboo sticks. What is garroting? Strangulation by iron collars. And we know garroting has got I, R, O, N alphabets. The trick to remember that it is due to strangulation is by iron collars. What is mugging? Strangulation by bend of elbow, bend of knee, or sole of foot. So yes, out of exclusion, my answer is gagging. If you are not able to recall, but directly, if you remember that what is gagging? Obstruction of oronasopharynx by a cloth-like substance. That is a sort of asphyxia. That is not a type of strangulation. Which type of drowning is associated with hyperkalemia most commonly? Answer. Which type of drowning is associated with hyperkalemia? Hyperkalemia. Correct answer goes with fresh water. Always, always. Everyone answering correct. Very good. So in fresh water, usually what happens is hemodilution due to rupture of RBCs. RBCs are rich in potassium, and as a result of hemodilution, the levels of other electrolytes will be decreased, like sodium, chloride, magnesium, calcium. They will be decreased. But what about potassium? Potassium will be very high, and this is usually the cause of death. This acute hyperkalemia leads to ventricular fibrillation and kills people. In seawater, what happens is hemoconcentration. Hemoconcentration, as a result of which, usually these electrolytes levels are seen to be mildly raised. There is no major change in potassium level as such, because potassium maximum concentration is present in red blood cells. Maximum rise in seawater is of sodium and chloride. Some sodium chloride diffuses from the alveolar chambers to the vascular compartment. Maximum rise is of sodium chloride. Come to brush burn. What is brush burn? Which type of burn we are talking about? Which type of burn I am talking about? Brush burn is a type of abrasion. It is a type of blunt injury. It is a type of blunt injury. So brush burn is also called friction burn. Friction burn sometimes, and it is also Which type of abrasion? Grazed abrasions. Another name for grazing over any body part, which can occur due to dragging effect over a part of the body, mainly seen in road traffic accidents. Due to this grazing, what happens is increased local heat production. Because of that local heat production, a sort of burn-like appearance will be there. And that is why grazed abraded areas are also called as brush burn areas. Correct answer goes with C. Person employed without medical qualification in medical field is called. इसका आंसर बताओ. All of you try to answer this. What should be the correct answer to this one? Person employed without medical qualification in medical field. Answer goes with covering. Answer goes with covering. What is covering? Association with a unqualified person. Association with unqualified person. What is perjury? Willfully giving false evidence under oath. Adultery, you all know. What is dichotomy? Fee splitting between doctors by unwanted reference. All these are unethical acts too, if done by a doctor during the course of duty. If he is associating with an unqualified person like compounder to do his work, he is participating into unethical act. Then alcohol and addiction not to be done during the course of duty. After duty you can, but not during the course of your duty hours. First permanent tooth to erupt. First permanent tooth to erupt is quickly molar 1. Molar 1 is first at the age of 6 years. Answer goes with this, which is इसका आंसर बताओ पहले. के बाद I will be asking few questions. Excessive sexual desire in males is known as, one of the recent exam questions of your exam. Excessive sexual desire in males is called satyriasis. The same thing in females is known as nymphomania. Masochism is giving pain to self. Voyeurism we have discussed earlier. Sadism is giving pain to others. If I write this word, someone is getting hurt by someone. A person A is getting hurt and he is getting gratified, sexually gratified. What is this A? Masochist or sadist? A is getting sexual gratification by getting hurt. Who is A? Sadist है या masochist है? He is a masochist person. He is getting the pain and he is getting gratified. This A is hurting his partner and then he is getting gratified. What is this A in this scenario? He is a sadist. He is giving pain to someone and he is getting gratified. So remember these English words. Answer this question. Simple question. Asked in your exam. A physician doctor referred a patient to a radiologist. Someone from the radiologist visited with a thank you letter and money packet. Which, what is true regarding of fee splitting between doctors is being done by unwanted reference. This is what is called medical dichotomy. This is what is called medical dichotomy. Answer this. Examination of a stain sample under microscope was done. This was the output under microscope. We are seeing crystals like this. These will be seen in which of the following? So crystals are light brown colored and rhombic shape. So these are associated with Teichmann's test. If I say dark brown crystals were noted and rhombic shape crystals, and the sample was a white stain sample which was being analyzed, and we got the output almost same. The crystals were a little bit dark in color. They were brownish. Which test I am talking about? Just the name of the test. Which test I am talking about? If I say that the crystals were dark brown and rhombic shape, but that sample being analyzed was white stain sample. We are talking about Florals test. Florals test. The output of Teichmann's and Florals is almost same. Mild difference is it is light brown, this is dark brown. But where lies the major difference? In Teichmann, the sample will be a red stain sample. Here the sample is a white stain sample. Correct? Which is the most reliable test for blood stain analysis, spectroscopic examination of the sample. In Barbarios, what is the output? Yellow color needle shaped crystals made up of spermin picrate. What is the source of spermin? Prostatic secretions. In Takayama, the crystals are made pink feathery crystals. And in Florence, the crystals are made up of choline iodide. What is the source of choline? Seminal vesicle secretion. Revised? The simple topic of stain analysis. Answer this one. A dead body was brought for autopsy and we are seeing a picture like this. What will be the smell or odor in this case? What will be the odor in this case? The odor in this case will be, there won't be any odor. Why? Because what is happening to the dead body is desiccation of body tissues, which happen in hot and dry climate. So whenever hot and dry wind is blowing, bacterial putrefaction is inhibited because of this extreme climatic condition, and the dead body will be odorless. And what is this post-mortem change called as? Mummification. Mummification. Ammoniacal odor in a dead body is associated with which changes? Adipose ear changes. A for ammonia, A for adipose ear formation is hydrogenation of body fats into fatty acids, and this gives ammonia-like odor. Bitter almond odor is coming during autopsy of a poisoning case. Which poison I am talking about? Cyanides. Burnt rope odor is associated with which poisoning event? Cannabis. From cannabis, what are the products we obtain? We obtain our precious BCG. What is BCG? Bhang, charas and ganja. So this image goes with mummification. This image goes with your adipose ear formation. The dead body in adipose ear formation gets a yellowish creamy appearance. They will be slippery to touch. And here there is desiccation of the body tissue. So the dead body will show you a dry shriveled appearance. Answer this one. The body was recovered within few minutes of death. This is the clincher given in the questions. This is common, and this was the condition noted. This is commonly associated with which of the following? Here the correct answer goes with cadaveric spasm, which is also called as cataleptic rigidity or instantaneous rigor mortis. So what happens within minutes? Rest of the body muscles will be flaccid. But what I am noticing is that the hand muscles are contractile. Means in these hand muscles, there must be total loss of ATPs when at the time of somatic death itself. This normally does not happen. Why this happen? Might have happened? This might have happened due to struggle at the time of death. The person must be using his hand muscles vigorously. So loss of ATPs occurred at the same time his death occurred. But yes, there were no more ATPs to relax the muscles. They went into contraction. And what is this called? Cadaveric spasm or cataleptic rigidity or instant rigor mortis. While rest of the body muscles will be flaccid. Their rigor mortis will happen after some time when the molecular death will occur in the individual muscle. Once rigor mortis comes in these muscles like forearm muscles, and now you cannot differentiate cadaveric spasm and rigor mortis. It can be differentiated in the time when rigor mortis has not started in those group of muscles. Answer this one. During autopsy, this is the picture which we note. What is this clinically suggestive of? Asked in FMG exams itself. A repeat question. So in such images now, you should be able to identify what is being shown. Then things will become very simple. Here the answer is cardiac tamponade. Suppose next time they show you something in the lungs, you should be in a position to answer any such questions too. So what is important is, yes, this is the rib cage boundary which has been removed. This is the rib cage boundary. Try to identify. Then this one is your right lung. This one is our left lung. And this is the area of heart. So when the pericardium was removed, I am seeing lots of blood in the pericardial cavity, which is normally not present. And this is what is called hemopericardium or cardiac tamponade. Easy to identify, where we get a triad of muffled heart sounds, distended neck veins, and hypotension leading to reflex tachycardia. And what is this triad called as? Beck's triad. Muffled heart sound, distended neck veins, and hypotension leading to reflex tachycardia. What is brachial index out of the following? What is brachial index? Brachial index is radiohumeral index. Another name for radiohumeral index. So length of the radius bone. If these bones have been brought by a policeman, and what he is trying to identify? He is trying to identify some parameters of identification. So I have taken length of radius bone over osteometric board. I have divided this with length of humerus bone, and I am obtaining an index to identify which parameter: age, race, sex, stature. Four options. What we are identifying with brachial index? What are we trying to identify with brachial index? Age, race, sex, stature. Race of a person. Correct now? So race of a person can be identified by how many indexes? Let us just quickly recall. For this, I will watch CNBT channel. I stands for, I will be writing the short forms, taking into account that you have read this. Intermembral index, C for cephalic index, N for nasal index, B for brachial, and C for crural index. Crural index. What is crural index? Also called as tibiofemoral index. Length of the tibia divided by length of femur multiplied by 100. What is brachial? Radiohumeral index. Radius upon humerus length. What is nasal index? Width of the nose divided by height of the nose multiplied by 100. What is cephalic index? Maximum breadth of the skull bone divided by length of the skull bone multiplied by 100. And the measurements in cephalic index are taken with the help of that instrument called vernier calipers. What is intermembral? Keep the values of brachial together in numerator, length of radius and humerus together in numerator, and divide this with length of tibia and femur and multiply them with 100. You will obtain intermembral index values. All these are indexes for racial identification. Overall, the first tooth to appear is which of the following? Overall. Temporary and permanent word is not written. Overall, the first tooth to appear will be temporary teeth. So which is the first temporary teeth to appear? Basically, the question is like that. Answer goes with A, LCI. So lower central incisor is the first teeth or the first temporary teeth to erupt at the age of 6 months. Which is the last temporary teeth to erupt? Molar 2, roughly at the age of 2.5 years. Which is the first permanent teeth to erupt in relation to permanent teeth eruption? Molar 1 at the age of 6 years, and molar 3 roughly between 17 to 18 to 25 years. 17, 18 to 25 years, very long range is for molar 3. Section 84 deals with which of the following? Section 84 deals with criminal responsibility of mentally ill. So, Section 84 IPC was formulated in which year? Answer. It was formulated in which year? In the year when all our IPC sections were made, 1860. And this was inculcated in our IPCs based on McNaughton's judgment, also called as McNaughton's rule, which is the case of Daniel McNaughton, a Britisher who tried to kill British Prime Minister under the effect of paranoid schizophrenia. He was having a delusion of persecution. So he made an attempt to kill the British Prime Minister. Somehow he was saved, but this McNaughton was caught. And yes, the case went on. The final judgment was, due to delusion of persecution, McNaughton is unaware that what he is doing is wrong or opposite to law, and he was unable to understand nature and consequences of his act. And it was inculcated. It was a British case. We have been ruled by Britishers. So Britishers made this McNaughton's judgment, which came in roughly about 1843. If they ask you, McNaughton's rule was formulated in 1843. 84 IPC, it became a part of 84 IPC of our Indian laws, which we are utilizing nowadays in 1860. And this is said to be the legal test for insanity in India. And another name is also used for this. This is also sometimes called a right or wrong test. Right or wrong. Most reliable method of identification overall is which of the following? Most reliable method of identification is which of the following? Let me see who answers this fastest. Ye wala dekho. I have twisted the options myself. Very good, very good. Option A being answered by many people. Very good. D is also being answered by many people. Very good. Correct answer is option B. What is Galton method of identification? This is another name for fingerprinting. तो जरूरी थोड़ी कि fingerprint word ही हो. फंसाने के लिए they can give options like this. ना? So yes, fingerprinting, also called dactylography or dermatoglyphics, was systemized by Galton, so also called as Galton's method of identification. Now come to power of judges, hierarchy of judges. Answer few questions related to those topics. Minimum rank of judge having power for fine of 5,000 rupees and imprisonment of 3 years. Which rank of judge will, minimum rank of judge will have this power? That is the question. I will come to the answer later on. Let us just quickly revise this topic, which you all neglect actually. So at the lowest ranks of judicial courts, we have judicial magistrate court, where the hierarchy is second class at the lowest rank, then comes first class, and then comes CJM, Chief Judicial Magistrate. And in relation to fine power and imprisonment powers, these are the two judicial powers of judicial magistrates and other judicial judges. So fine power is 5,000 for second class, 10,000 for first class, and CJM has got unlimited fine power. Regarding imprisonment, 1 year, 3 year, 7 year. Now look at the question. Fine of 5,000, but the imprisonment is 3 years. Second class cannot be my answer, na? This cannot be my answer. And the minimum rank answer should be first class judicial magistrate. So yes, correct answer goes with option A. Above judicial magistrate, which are the magistrates which are available? Above judicial magistrates, we have sessions court. And always remember, judicial magistrates and sessions judges, they are appointed by which authority? They are appointed by state government. This is a repeat question. FMG exam repeat question. Judicial magistrates as well as sessions judges at district level, they are appointed by state government authorities. And in the sessions or district level, we have assistant session judge. Then we have additional session judges. And on top, we have district and session judge. So they will all have unlimited fine power. If CJM, a rank below, was having that power. Assistant session has imprisonment power of 10 years. Additional says, I have got lots of D alphabet, so I will have this unique power of death sentencing. D for death sentencing. Nothing to remember more. If a judge is having death sentencing power, he will obviously have life imprisonment power too. What is the minimum rank of judge having death sentencing power? Additional session. What is the minimum rank of judge having unlimited fine power? CJM. Correct? So you can answer any question. Above sessions judges will be High Court judges and Supreme Court judges. Now, juvenile court is presided by which of the following? Usually, a juvenile court is presided by which of the following judges? First class women magistrate is preferred. Along with this first class women magistrate, mandatorily there should be 2 female social workers besides the judge. They should be present all the time. If this women magistrate is not available, it can be male. It can be a male magistrate. But with regards to social workers, they always have to be females. So this is how juvenile court is presided. And what is the name given to these first class magistrates in juvenile courts? They are called as What do you call them? You call them principal magistrate. Principal magistrate. And it is the first class judicial magistrates who are referred to as metropolitan magistrate in metro cities. Now answer this one. Left lower canine according to the method of FDI, method of dental charting. This is the full form of FDI method. Left lower canine is designated as. And these are the options. Can anyone tell me which teeth we are talking about? Permanent teeth or temporary teeth? By looking at the options. Yes, women magistrate is to be preferred in juvenile courts. If at all suppose a women magistrate is not available and a case has to be presided, a male magistrate can preside. But the social workers have to be female social workers. So this is permanent dental charting. So answer batao. So come on, tell the answer to this. Left lower canine. So what I will recall, this method of charting is unique. It starts from right upper quadrant. Start writing number 1, 2, 3, 4 like this. And divide your jaw into 4 quadrants like this. Make this 1 as 11, 2 as 21, 3 as 31, 4 as 41. And go on increasing the numbers by 1. So left lower canine. So this side is always right in charting. This side is always left in charting. So we have to consider this side. And that to lower side means number 3. So this cannot be my answer. This cannot be my answer. So central incisors, lateral incisors, canines. So the question is about third teeth. So third teeth will be represented by which number? 33. That becomes my answer of choice. Very good. So just have a quick recap with the help of images of this simple topic. So what is the name of this method of dental charting? This method is called Universal Cunningham method. This is Universal Cunningham method of dental charting, where this image is for temporary teeth or notation and this is for permanent teeth notation. Temporary teeth are denoted by alphabets A to J, starting from right upper quadrant in a clockwise manner and then moving clockwise in the lower quadrant like this. Permanent teeth are represented by numbers 16 teeth of upper jaw and then 17 to 32 for lower jaw teeth. What is this method of dental charting called? This is what is called Palmer's. This is for temporary teeth. This is for permanent teeth. Black in black. No? What is this method of charting called? Class will be up to 10:15. 10:15 or 20. I will finish whatever I have thought of completely. So this is header up method of dental charting. In the end, I will summarize. Not to worry. Check. Okay. So this is header up method of. Now see, these are very simple. This is UC method. My college UCMS. So this is UC method. In UC, temporary teeth are denoted with the help of alphabets. Start from right upper. This side is always right in charting. This side is always left in charting. Whatever may be the type of teeth, temporary or permanent, this side in charting is always right. This side is always left of the patient. So if you remember this much, things will remain always simple. Right, left. Here it will be right. It will be left. And in Palmer's, the jaw has been divided into 4 quadrants. This is header up method. The jaw has been divided into 4 quadrants. And plus sign is given for upper jaw and minus sign is given for lower jaw. For temporary teeth too, you will see that plus is for upper jaw, minus is for lower jaw. To make a distinction, because numbers were used in both permanent and temporary teeth notation, header up said, what I will do is, I will utilize 0 before the number. The moment you see a 0 with a plus sign, this teeth is belonging to the upper jaw. Now, can you tell the side of the teeth? Suppose I write like this. I write like this. Plus 0, 1. What is the complete information? complete information is this is left-sided, temporary, upper, central incisor. Why I'm telling it to be left side? Because what I'm noticing is that the plus sign I have written to the left of the number. So if I write a question, if I prepare a question like this teeth will be right-sided teeth. Why? Because for right-sided teeth, plus sign is located to the right of the number. This is a hidden information in header up method of charting, which can be framed as a new question. I have got the idea now. See the location of plus and minus. For right-sided teeth, the plus sign is to the right of the number. For left-sided teeth, the plus sign or minus sign is to the left of the number. Now, this is our FDI method of dental charting. Overall, the best method of dental charting, because what happens is every teeth gets a unique number, be it permanent or be it temporary. For permanent, start writing 1, 2, 3, 4 like this from right upper quadrant in a clockwise manner. And for temporary, start from right side and after 4 comes 5 na? So 5, 6, 7, 8. And make them double digit numbers. This one to be made 11 to 21 like that. And in temporary charting, yes, every quadrant will have 5 teeth. In permanent charting, every quadrant will have 8 teeth. So here the number of teeth in total will be 32. Here the number of teeth in total will be 20. Well, I hope it is clear. Simple. Gold chloride test is used in detection of which of the following poisoning event? कहाँ पर use करते हैं gold chloride test? It is used for cocaine poisoning. Gold chloride testing. Now, what is gold chloride testing? Gold chloride testing is for cocaine poisoning. So this is how the no Afrin, I only teach my subject. I believe in teaching the core subject in which you have the proper understanding. If I am not having understanding, full understanding of a subject, what does it mean to teach a subject? So I love my subject and I teach my core subject. So here the crystals in the slide will be seen to be having central filaments to which you will see perpendicular plates being attached. So this is the image based question which can come in any exam. So this is gold chloride testing for detection of cocaine. So when I take a glass slide and if I put suspected blood stain of that addict in which the testing was to be done, from outside I add gold chloride as a reagent. Then I put a cover slip. And if I start watching under microscope, I will get a film like this. Answer this one. Blackening and tattooing of skin and clothing can be best demonstrated by. Blackening and tattooing of skin and clothing can be best demonstrated by. Okay. Okay, George. Finished? Had fun when you completed all the classes, all the sessions? So blackening and tattooing of skin and clothing can be best demonstrated by infrared. Infra has this firearm word hidden. Infra has this firearm word hidden. The following situations are associated with rise of temperature after death except burns. So what is this condition called? Rise of temperature after death. This is what is called post-mortem caloricity. So in post-mortem caloricity, there are important causes like heat stroke, pontine hemorrhage, any septicemia. Along with that, along with that, along with that, what is that which is not here written here? Anyone? Anyone? Strychnine poison. Strychnine poison. Answer this one. Perjury. So these are the four causes of important causes of PM caloricity to be remembered. Perjury is defined. The basic question is, the question is regarding imprisonment. Always read the lines and see the crux of the question. What is being asked? They have not asked the definition of perjury. So imprisonment may extend to 7 years under which section? It may extend up to 7 years under 193. 193. The most reliable criterion Gustafson's method of identification, which is a study method done on teeth to estimate teeth, is utilized to estimate age of the person. Age is estimated from teeth of dead individuals. So here the best criteria is, or the most reliable criteria is transparency. Which is the worst criteria? Worst is this one. And second best is secondary dentine. So these are the 6 criteria. Na? Secondary dentine, cementum opposition, root resorption. I for eye of attrition. P for parodontosis and T for transparency of root. So transparency is best. Secondary dentine is second best. Goes with the name I for eye of attrition. Any I alphabets. A patient of head injury has no relatives and requires urgent laparotomy. Doctor can, what you can do as a doctor? Suppose you are that doctor. What you will do? These are not only to solve MCQs. These are, we should remember throughout our practice. You can operate without formal consent as per which IPC? Fill in the blanks. As per which IPC section? Options do 90, 91, 92, 93. 4 options. As per 92, 92. 82 wala hai. 82 IPC is a child less than 7 years is not responsible for any of his act. 82 is for child less than 7 years. Is not responsible. 92 is for widow. So that's all for today in this session. Now you can clarify any of your queries. Any queries which you are having in any topic, I will devote 5 to 10 minutes for your queries. Anything which you want to clarify. There will be another session of some test discussions, questions, most likely on 14th of October. Any query which anyone is having, house is open for your queries. So the preparation is going on track for all of you. नहीं जा रहा तो track पे लाना है. If it is not going, bring it on track. Now is high time na? Already mid of October. So mid of November and then 4th December you have your exams. Any query or anything which you want to ask or any doubt? So next session will be on 14th of October at about 8 o'clock in the evening. So that will be a test series discussion. Questions of the test. Something is being taken by me. So those test questions I will be discussing. So you can give this Unacademy Combat to grab the prizes and to assess yours. So time to end the session. Attrition. Attrition means wearing and tearing. Like we chew things, na? We chew our food. Attrition simply means wearing and tearing of the mastication surface of the teeth. Wearing and tearing. With age, the more you chew, more wearing and tearing will occur. So that is graded. That was graded in Gustafson's law. This is what is attrition. Cement apposition, cement material basically increases with age, transparency increases with age. Root resorption means root has decaying changes. Secondary dentine is there is deposition of secondary dentine in the pulp cavity. Parodontosis is there is regression of periodontal ligaments and tissues. So regression is of rest in peace. Root resorption occurs. Attrition is wearing and tearing. Parodontosis means regression of periodontal ligament. So they go in rest in peace. Which criteria? Root resorption, attrition, parodontosis. While secondary dentine, cement material and transparency, they are going up with age. This was noted by Gustafson. Clear? RIP means rest in peace. No? So they go in rest in peace with age. Which criteria? RIP criteria. Root resorption, attrition and parodontosis. Easy way to remember. Any other queries? And my Telegram group is there to certify all your subject queries. So remain connected there. So time to end the session. Bye bye. Bye bye. Name of the Telegram group, it's in the name of FMT concept. FMT in capital, concept word in small without any gap in between. And you can avail those prizes from this combat, which is going to happen on October 16th. List of topics important that list of important topics I have already shared few sometimes back. I will reshare that in the Telegram group, not to worry. Okay, Ankit. For FMG exams, list of important topics for FMGs. So then, Babish. So all my best wishes to all of you. Keep on working hard. Keep on revising things. You all will do wonders in your life.